Hi, my name is Kayla Bottoms, and today I'm going to inform you about Alzheimer's disease. Alzheimer's disease is one of the leading causes of death in the elderly. Although the cause is unknown, theories are available. Because no causes have been determined, there is no cure. Treatments are available, however. Imagine standing on a street corner and watching a middle-aged to elderly person walk into a well-lit 5-story house. Every light in the house is on, but as they move through their home, lights in certain rooms seem to shut off one by one. Lights go off in each room on the top floor, starting from the left and moving to the right, and then the lights start to go off starting on the next floor and so on. Suddenly, their home has become an estranged house. Watching this happen is like watching someone move through the stages of Alzheimer's disease, and watching their memory fade away just like turning out the light. Many of you probably know somebody that has this devastating disease and it has affected you in an unexplainable way. Both of my great-grandmothers suffer from Alzheimer's disease, both at late onset, and both died as victims of the disease. And last year in my English comp class, I conducted a research paper over Alzheimer's disease. Alzheimer's disease is one of the leading causes of death in the elderly. Although the cause is unknown, theories are available. Because no causes have been determined, there is no cure. Treatments are available. First, I will describe the most common cognitive disease, that is Alzheimer's. Second, I will examine causes that could possibly be the reason behind the disease and other diseases related to Alzheimer's. And third, I will discuss prevention and treatments for the disease. Dementia, specifically Alzheimer's, is one of the leading causes of death in the elderly, second to heart failure. There are two types of Alzheimer's disease, sporadic and familial. There are also two types of sporadic Alzheimer's, early onset and late onset Alzheimer's. According to the Cambridge Historical Dictionary of Disease, there are not only cognitive and thinking problems, but also psychological and social inactivity. The brain shrinks from losing many nerve cells, causing cognitive impairments. This disease could end up lasting approximately 5 to 15 years. The stages of Alzheimer's is from Harvard Women's Health Watch. The risk of Alzheimer's doubles every 5 years after the age of 65, but women run the higher risk of Alzheimer's compared to men. Brain and nerve cells become destroyed, which transmit all the brain signals which cause the symptoms of Alzheimer's. There are 5 specific stages of the disease listed in increasing order over time and the progression of symptoms. Stage 1 includes memory lapses, inability to concentrate, and failing recall. Stage 2 involves inability to recall recent and past events, and cooking and driving abilities are impaired. Stage 3 includes mood swings and forgetting the date or season. Stage 4 contains communication impairment, hallucinations, and agitation. At stage 5, the patient is bedridden and cannot speak or eat. Now that I've described what Alzheimer's is and the stages at which it may occur, let's look at the possible causes of Alzheimer's disease. Aging is considered a very probable cause for Alzheimer's, but it may not be the only cause there is. There are 2 types of Alzheimer's, early onset and late onset. An article written by Dr. Groening and others have suggested the presence of cerebrospinal fluid biomarkers coordinating with the progression of early onset. Patients with early onset may have a more severe case of Alzheimer's because their lifestyle is so active. The rate of progression in the disease depends on the severity of the disease. The irregular biomarkers in the cerebrospinal fluid is the cause of faster progression, especially in patients with the APOE4 genotype. The early onset patients were suspected to have higher rates of the protein tau, helping with the faster progression. The APOE4 has 3 alleles, E2, E3, and E4. 30% of people in the U.S. carry the E4 allele and have the greatest risk of future Alzheimer's. A person inheriting the E4 allele from both parents runs a 90% chance of developing the disease. However, with all of this knowledge, scientists have figured out about the E4 allele. They do not know its function in Alzheimer's. There are certain diseases that are related to Alzheimer's, including Huntington's, Parkinson's, and Lewy body dementia. Huntington's is one in that a patient's physical abilities will be decreased and even deteriorated. Walking, thinking, talking, and reasoning will all eventually disappear. One defect in the chromosome may cause this disease by a tripled repeat. This disease, like Alzheimer's, has major cognitive impairments, such as short-term memory loss and the inability to concentrate. Parkinson's disease patients can experience declining function of their central nervous system. This disease is caused by decaying neurons in the substantia nigra, a part of the brainstem. As a result, none of the other neurons in the brain will function, and like Alzheimer's, there's not a cure for the disease, but only treatments that can be done on the patient. Lewy body dementia includes hallucination and reduced cognitive abilities. Often, Alzheimer's and Parkinson's are shown in Lewy body dementia patients. This disease is caused by excess deposits of protein in the brain. The proteins can move to different parts of the brain to cause deduced thinking and behavior. Declining of cognitive function is the major diagnosis. We've now covered the definition of Alzheimer's and possible causes and associated diseases, but let's now look at prevention and treatments for the disease. Alzheimer's disease may be prevented in some ways, and some treatments are available for side effects. An article from the Alzheimer's Association lists medications that can be taken to reduce memory loss. Cholinesterase inhibitors can be taken in early stages to delay symptoms from getting worse for up to 1 year. These types of medicines are donazepam, rivagastamine, and galantamine. Vitamin E can be taken at any time by a doctor recommendation only, and it will attempt to temporarily protect cells of brains and tissues. Approaches not involving drugs include plenty of rest, a quiet environment, and having some type of security object that keeps the patient at ease. Alzheimer's disease is a cognitive disease that impairs a patient's mental ability. Possible causes were examined that could possibly be the reason behind the disease and other diseases related. Prevention and treatments are available for this devastating disease. Hopefully one day scientists will find the cause of the disease, which may be well hidden in a part of the brain that is unknown, and the disease itself can become extinct. If scientists are able to get rid of Alzheimer's disease, there could be many other possible diseases that could be rid of in human life as well. Thank you.